Hi, this is Tally with American Sunrise Consulting, and today I want to show you how to use the Medicare quoting tool to find the correct prescription drug plan that would fit your needs for the year 2026. And what you're going to do is go to medicare.gov/plan-number sign/question mark LANG=EN year equal 2026, or you could use the link that I posted below this video. On this page, you have the option to actually log in or create an account, or you can continue without logging in. So the first thing you're going to do is you're going to enter your zip code, whatever it is right here, and you're going to select Medicare Drug Plan Part D. Click on Find Plans, and then it's going to ask you a few questions, such as, if you are receiving Medicaid or any supplemental benefits or extra help. That's another program. And if you don't receive any help, just click this button and continue. Then it's going to ask if you want to see the drug costs when comparing plans, and you're going to say yes. And now you're going to begin typing the name of your prescription. So when you begin typing, it's going to populate whatever prescription name and you have to select from the drop down menu. So I'm going to select lisinopril just for an example. If you do not select from the drop down, you're not going to be able to use the quoting tool correctly. So you have to select from the drop down. You click on Add Drug, and now it's going to ask you for the dosage and the quantity and the frequency. Try to be as exact as possible, but if it's not 100% exact, it's not the end of the world. But let's say you're taking 20 milligrams. So you have to use, again, the drop-down menu, and then the quantity you can type in. Let's say you take like 30 every month, or let's say you take 90 every 3 months. Okay, and then you're going to add the drug to the list, and you're going to just keep adding whatever prescriptions you currently take. Okay, and you have to let me do another one here. I'm just putting in alprazolam, add drug, select the milligram, the quantity, and how frequent you need it, and add to the list. Once you're done adding all your prescriptions, you're going to say done adding drugs, and now you're going to again enter your location, and you can start by naming the pharmacy that you want, or what I typically do is I click on several pharmacies, because you want to see how this affects your cost, right? So typically I use like Publix, maybe Walmart pharmacy. I'm going to use CVS. And Walgreens. And maybe I'll do like Costco. And the reason that I do the big box stores is because I don't have a private pharmacy name to put in here, but also a lot of times, oh, it says already selected. Okay, so I can only do 5 at a time. A lot of times the private pharmacies are not going to be listed as preferred pharmacies, unfortunately. So I just like to see what is like the most cost-effective way to get the prescription. So you see I have 5 pharmacies here to compare. I'm going to click the next step, and now it's going to populate all the plans in my zip code in the order of being most cost effective. Okay, now looking at this plan, I could see the monthly premium, I could see the retail pharmacy cost, which is the total drug plus the premium for the year, and I can see the mail order. I could see that the deductible on this plan is $615, but my total out of pocket is $166. So how does that work? Well, when I click on plan details, now I'm going to open this up, and it shows me I'm going to pay 0 to be enrolled in this plan, and my total for the year will be $166 or $176 if I use their mail order. When I go over here, I can see the names of the drugs I entered with the quantity, frequency, and I guess it tells me here whether it's generic or brand. And then it gives me an overview of the pharmacies. I could see that CVS, Walgreens, and Publix and mail order are preferred in this plan, but all of these pharmacies are in network. Then I'm looking at the yearly drug cost by pharmacy, and I can see how much it's going to cost at CVS, how much it's going to cost at Walgreens, Publix, Walmart, and mail order. Now I'm going to go down, and it's going to give me the estimated total drug plus the premium. Being that this plan is a $0 premium, it isn't different than what's up here. And now I'm looking at the months. Now, because I indicated that I wanted to fill these drugs every 90 days, it's only going to show January, April, July, and October. But if I had put that I wanted my prescriptions once a month, we would see all the months of the year over here. And then each pharmacy, how much am I going to spend per month at the pharmacy? Okay, so I see CVS in January is going to be $44, Walgreens $41, and so on and so forth. And then over here, if I click on each pharmacy, I can see more details. So for example, for CVS, I can see that alprazolam is $44.35 retail, and that the cost before the deductible is $44.35, and that the cost after the deductible is $17.74. And then the cost after the maximum out of pocket is reached, or the cap, is 0. Okay? And same thing I can see here for lisinopril is $1.15 retail cost. It's $0 before the deductible, $0 after the deductible, and $0 here. All right, now as I go down the line, I could see how much the drugs cost at each pharmacy. Then I'm going to want to click on View More Drug Details. Okay, here you can see how much each tier, how much is the copay in the initial coverage phase for each tier. So this is the initial coverage phase right here. Preferred generic is tier 1, and I could see that the initial coverage phase is 0. The generic is tier 2, it's $3 copay. Preferred brand is a $25 coinsurance. Non-preferred drug is 40% coinsurance. Specialty tier is 25% coinsurance, and a select care drug is $11 copay. And when I look over here, I can see that in this particular plan, alprazolam 1 milligram is tier 4, and that there are quantity limits. There's no prior authorization, and it's not under step therapy. For lisinopril, I see that it's tier 1 and nothing here. And over here I can see the overall rating for this plan. And that's just satisfaction of the plan and so on. So one of the things that I'm looking at here about alprazolam, seeing that it's a tier 4 drug, okay, it means to me that I'm going to have to pay retail for this drug until I reach the deductible. Now, if we go back to the very top, we see that the deductible for this plan is $615, which that is the maximum deductible for the year 2026. And what happens with this deductible is for tier 1, any drug that falls under tier 1, they waive the deductible. In other words, you don't have to pay retail until you meet the deductible. You are going to pay the initial coverage phase copay, which a lot of times is 0 or just a few dollars, okay? Now, for drugs that are tier 2, some plans also waive this deductible. But for drugs that are tier 3, you're going to have to pay retail. Like you see here, you're paying the retail cost of the drug until you meet the deductible. So if in the middle of the year you get a new prescription that's a tier 3 or a tier 4 drug, and all you've had previous was a tier 1 or tier 2 drug, then don't be surprised if you have to meet the deductible at that point, because it is a tier 3, tier 4, or tier 5 drug. But if you only take tier 1 or tier 1 and tier 2 drugs, the deductible is going to be waived. So that is the main thing to understand about the deductible, is that if your drug falls under the category that requires you to pay the deductible, you're going to have to pay that out of pocket first. If the drug is very expensive, then you may meet the deductible the first time that you fill the drug. But if the drug is not so expensive, like here, $44 is the retail price, then that's the price you're going to pay until you meet the deductible. And so if you like what you see here, then what you would do next is, and you can print this out too. You can actually click the print. You can either print it on your printer, or you can save it as a PDF to your computer if you want to remember this, okay? And as you see also, there are phone numbers here if you need extra help. And if you go back to this area here and you decide that you want to enroll in this plan, there will be an enroll button. We don't see it yet because we are just a few days out from the open enrollment, or annual election, I should rather say. If I click on Show Me 2025 Plans up here, then I'm going to have the option, oh, we cannot enroll at this time. I guess you can't enroll in any plan right now over here. So if you have any questions, feel free to reach out to me, 561-929-1079. Just to be completely frank, many companies are no longer paying agents to help people with prescription drug plans. And because it's a very tedious task, no one likes to work for free. So that is the reason that I created this video, because I want to help clients, but to spend an hour on the phone with each person is just unrealistic at this point. So I created this video as an aid to help people to locate a plan that would work for them for the plan year. And you're going to want to do this every year, so you might want to go ahead and create an account on Medicare.gov so that your prescriptions are going to be in here and you don't have to keep doing this over and over again. And of course, if anything changes, you can always add or edit your prescriptions. And I think it's a great way for people to just be able to see which plan is going to be the best fit for their needs. I hope this was helpful, and like I said, feel free to reach out if you have any questions. If you need any help with any other type of coverage, of course, then I can help you with that as well. We have Medicare supplement plans, we have Medicare Advantage plans, dental plans, we have hospital indemnity, and so I can definitely give you quotes for whatever plan you're looking for. But this is how you use Medicare.gov to find the drug plan that you'll need for the upcoming plan year. All right, take care.